Hello and welcome to this capsule, Baby and its Characteristics. Today we will talk about these subjects of the newborn: head, skin, temperature, breathing, eyes, umbilical cord, genital organs at birth, and hygiene. The baby's head is large and heavy, and it will need support during the first 3 months. The bones of the skull are not yet knitted, and the fontanelles will close between 9 and 18 months old. The fontanelles is on top of the head is in the shape of a diamond, and the one on the back of the head is in the shape of a triangle. These areas are fragile, but it is safe to touch them gently. During childbirth, the baby's head is deformed by the pressure exerted during delivery, the baby's position, the use of the vacuum extractor, hump or swelling under the hair. The head will regain its round shape a few weeks after the delivery. This does not cause any damage. It is important to handle the baby's head gently. A bruise can be painful for the baby. Since the bones of the skull are still soft, the baby's head may become deformed and no longer be symmetrical if it spends too much time in the same position. Certain things can help prevent plagiocephaly, also known as flat head syndrome. Change the baby's position in its crib every day when the baby is lying on its back. The baby needs to spend time on its belly several times a day, supervised by mommy or daddy, in order to promote the development of its muscles and prevent plagiocephaly or flat head syndrome. Alternate positions when changing diapers. Change arms if you bottle feed your baby. Be careful with car seat and vibrating seats. The newborn skin is generally smooth and soft, and it may be transparent in places. Its color is reddish and varies based on the ethnic origin. It may have some unique particularities. Presence of milia, small white bumps that appear on the nose and face, that will disappear in the first months of life. Toxic erythema is very common, better known as newborn rash. No known cause, no treatment, non-painful, and disappears within a few days. Hand and foot acrocyanosis. Due to the immaturity of the circulatory system, it lasts a few hours after birth. The baby's skin may be dry, especially if the baby was born past its due date. Neonatal jaundice is a physiological condition caused by the immaturity of the liver. It happens around 2 or 3 days of life in most healthy babies. No treatment is necessary, unless the baby becomes drowsy and does not feed well. Jaundice does not have any consequence if the baby has bowel movements, urinates normally, gains proper weight, and grows well. The CLSC nurse will monitor it during home visits. Bilirubin is eliminated through stools, so it is important for the baby to drink enough milk. It usually disappears after 1 week, but it can last up to 2 months in breastfed babies. Following birth, the newborn will have difficulty maintaining its body heat. Skin to skin helps the baby regulate its body temperature. The ideal room temperature is between 20 degrees Celsius and 22 degrees Celsius. It is better to dress the baby well and to add or remove a blanket if necessary. The baby should not perspire. If that is the case, it is too hot. You do not need to take your baby's temperature every day. Only do so if you have doubts. It is important to have a rectal thermometer in your baby's cabinet. The preferred method for children aged 5 years and under is to take temperature rectally, because it is the most precise, reliable, safe, and quick method. Use a water-based lubricant and insert the thermometer about 1.5 centimeters deep. Normal temperature is between 36.5 degrees Celsius and 37.5 degrees Celsius. If the rectal temperature is over 38 degrees Celsius, your baby has a fever. Consult a physician if your baby is under 3 months old. Never give the baby a cold bath or rub it with alcohol. Acetaminophen is the best choice if your baby is over 3 months old. Tylenol, Tempra. It is important to have some at home for the first vaccines at 2 months old. Always rely on your baby's weight for medication. 15 milligrams per kilogram. Do not mix it with another liquid. Which quantity was ingested if the baby does not drink all of it? Ibuprofen, second choice. Motrin, Advil. Do not administer it to children under 6 months old. It is hard on the digestive system, and it may have some serious side effects. Breathing. The newborn's breathing is fast, deep, irregular, and sometimes noisy. Sneezing. Newborns can sneeze up to 12 times a day to get rid of secretions. The baby does not necessarily have a cold. The hairs protecting the nostrils are not developed enough. Saline solution. It is important to keep the nose clear because at this age, newborns do not breathe through their mouth. The preferred method is nasal hygiene with a saline solution. A recipe for a saline solution is available in the health section of the From Tiny Tot to Toddler Guide. You can also use solutions bought at a pharmacy, such as Salinex and Hydrosense. Use them with a dropper or small syringe. Nasal aspirator. When your baby's nose is very stuffed up or the saline solution does not work, always use the saline solution before the nasal aspirator to make secretions more liquid. Choose a nasal aspirator that can be fully dismantled for easy cleaning. Do not use medical nasal drops or sprays. Example, decongestants. Eyes. The newborn can see clearly up to 8 or 10 inches away. Until 6 months, the baby may seem to be cross-eyed. This is normal. It has difficulty controlling its muscles. Most newborns have blue eyes. The eyes usually adopt their permanent color between 3 months and 1 year old. Eye discharge. Gently wipe eye discharge with a damp washcloth or cotton ball. Use a clean section for each eye. Massage the corner of the eye can help unblock the tear ducts. Consult a physician in the presence of edema or redness. The umbilical cord is white at birth. It drops off between the 5th and 21st day. Clean the area with the cord every day with a cotton swab soaked in water. Dry around the cord after cleaning it and after bathing your baby. Leave to dry. Do not cover it with the diaper or a compress. It may leave traces of blood on your baby's clothes. Do not apply cream or alcohol. Consult your health professional if redness appears or if the belly button oozes fluid and smells bad. Girls. The labia minora are swollen for 2 to 3 days after birth. There may be a whitish deposit. It is an excellent protection against bacteria. Do not worry if a few drops of blood drip from the vagina in the first weeks. This is caused by extra hormones coming from the mother. To clean. Girls, gently wash and wipe from front to back. Wash and wipe the anal area from front to back. Boys, the testicles have descended into the scrotum, which is purplish red. The foreskin is the skin covering the head of the penis. Circumcision may be performed if it is medically indicated. If it is requested for religious reasons, it will be performed in the private sector. To clean. Boys, gently wash and wipe the penis, the scrotum, and the anus. Do not pull back the foreskin. Both boy and girl babies may have swollen breasts, which may even produce a little milk. Stools. The first stool is meconium, very dark and sticky. It is composed of the residue remaining in the baby's intestines. Maternal milk produced in the first few days, colostrum, favors the elimination of meconium. After the first few days, stools vary depending on the diet. Black or red stools are never normal. Urine. Normal urine is pale yellow and has no detectable smell. The presence of orange spots is usually a sign of dehydration. Disposable or washable diapers. Personal choice. Disposable, more costly in the long term. Washable, higher initial cost. Grant from La Ville de Sept-Îles. Change diapers frequently and as soon as there are stools. Wash genitals with soap and water. If you do not have access to water, use unscented disposable wet wipes. Vaseline, used in hospital for very sticky meconium. Zinc oxide cream. There are several types of zinc oxide ointments. If there is no redness, applying cream is not necessary. Let the skin breathe. However, apply cream at the first signs of redness. If the redness persists or there are many pimples, consult a physician. Do not use baby powder. It can cause breathing problems. It is better to wash your baby in the bathtub than to give a sponge bath. The bathing technique will be shown to you at the hospital. You can give the baby a full bath even if the cord is still present. The baby cries a lot the first few times when it is cold, but bath time will become pleasant as it grows. It is best to use mild, unscented soap. Never leave your baby alone in the bathtub. Always support its head and neck. The water temperature should be at 37 degrees Celsius. Do not add any warm or hot water while the baby is in the bathtub. Pay special attention to the folds of the baby when washing and drying. Bath seats are not recommended as several accidents are related to their use. Bathe your baby every other day, but clean its face, hands, genital, and bottom every day. Do not bathe your baby right after feeding. Getting ready. Gather all the necessary items and make sure the room temperature is between 22 degrees Celsius and 24 degrees Celsius. Remove your jewelry and wash your hands. From birth, clean the inside of your baby's mouth with a washcloth. This will help prevent thrush in the mouth and establish an oral health routine. As soon as the first teeth start to appear, soft bristle toothbrush and toothpaste. Beware of early childhood tooth decay. Nail clipper or scissors. During the first few weeks of life, your baby's nails are stuck to the skin. Use a nail file at first if necessary. Crusty patches on the scalp. Cradle cap, seborrhea. Yellowish or grayish crusty patches on the scalp due to surplus of oily secretions or shampoo that was not rinsed properly. Olive oil, mineral oil, etc. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.